how much qi is actually required. Where is the qi moving? How can I deepen my practice? Be curious. You will get answers.
Welcome everyone to this episode of the Wisdom Qigong podcast. My guest today is Meghna Patel. Meghna runs a health practice, a holistic health practice in Germany. And she has some incredible successes and stories you would like to talk about, where natural healing actually, in particular Zhineng Qigong and Hunyuan Qi therapy, helped people to recover from illnesses where Western medicine says, that is just not possible. And the reason why we got in touch, because one of her latest cases is actually a good friend of hers who had suffered a hemorrhagic stroke 2 years ago. So this is basically meaning blood vessels exploding in the brain and damaging the brain. And this is a very serious illness. And I think your friend has various issues afterwards. Maybe you can start by describing what happened and then how you treated that and what the successes were.
Sure. Yeah, thanks, Torsten, for the invitation. So it's really interesting. I was with him at the time where he had the stroke. And so I'm trained as a Hunyuan Qi therapist and have been doing Zhineng Qigong. So I immediately put myself and him in the Qi field and only put good information. I knew he was having a stroke. And then I connected with other Qigong practitioners who also supported the healing field, as it were. And then he had the stroke. And afterwards, I knew nothing about these things back then. Hemorrhagic stroke is one of the most dangerous types of strokes you can have. And only after 2 years or so, only 1 in 5 people survives this type of stroke. It's really unbelievable what happens. Most people die within the first 2 days of having such a stroke. So what happens is, like you said, the blood vessel bursts in the head. And then it damages a certain area of the brain. It's dependent. Each person is different. It damages a different part of the brain. And for him, it was the speech center and the motor center. So after the stroke, he was weak on the right-hand side of his body. And his speech center was completely gone. And in this time, the doctors basically said, he won't recover the movement on the right-hand side. And he'll still have something called foot drop, which is where the nerves connection to the feet are not properly working. And so you see many people who have had a stroke, their foot just sort of hangs there. It's not able to lift itself up. And so every day I treated him with Qigong therapy. And this was, first of all, just to calm the anxiety and strengthen and rebuild his whole field. It's really interesting when someone is so sick. This was fascinating for me. Their consciousness it's like a real explosion, and their consciousness gets broken up into 1,000 pieces. So it was like working with a baby in a way, this being that doesn't have a built-up consciousness center. And you see the development of how the consciousness starts building itself. And that's what every Zhineng Qigong practitioner does. You're collecting qi, you're becoming more mindful, you're becoming more conscious about everything you do. So it was kind of a weird parallel to every Zhineng Qigong practitioner. You're not quite sure why you're doing it, but you're doing it because you're feeling better. And so when I have to put a caveat in there, I have special abilities, so I can see qi, I can see energy, I can see how it moves. So this has developed over the 2 years as well, since I've been working with him naturally. But the consciousness of this friend was basically gone. And so he didn't have any life force, not so much life force in him. And so I was doing the daily treatments to build up the life force energy in him. And you could see day by day, his consciousness was improving, getting stronger. He was, after 2 weeks, able to move his right leg, you know. He started murmuring things. But it also made me very, very aware of how complex our bodies are and how many things are continuously working in the background that we are not aware of. Just to, for example, to speak. Because he has a problem with his speech center, you really don't know how much is involved in the speech center. When you start becoming aware of how many processes are actually going on in the body, you also become aware of how much qi is actually required to move all those parts and move all those parts in harmony. And if one part is not sort of working in coherence with the next part, the whole healing just cannot occur, right? So that's where I integrated more, okay, the medical knowledge of seeing how parts of the body worked and the Qigong knowledge of, okay, now we have to get Qi to flow through all of this. So anyone with illness will have to go through this in some way or another, or you bypass all the medical knowledge and you just say, with your consciousness, I'm going to heal and that's it. And that also works completely well. Yeah. But this journey was a little bit different. And so we went through that. So yeah, so daily Qi therapy for him. And of course, mindset. This was unbelievable because this friend of mine was an unbelievably active person. And he could speak actually 45 languages. So he was quite off the scale in terms of abilities himself. And then you get drawn down to absolutely nothing and dependent on everybody else. And of course, that makes a huge psychological impact. And Qi was really important on that part of the journey. And of course, I work with other therapies, so flower essence therapy, and everything that was nonverbal was fantastic at this stage. Yeah. So that's what I did. And then he was out of the clinic after 8 months. So he was actually in the rehabilitation for 8 months just to get him able to move.
Can I ask a clarifying question? So how active was your friend in the process? Was it basically you giving the treatments or did he actively participate? I mean, he did participate unconsciously, obviously, because it was his body that did the healing. But, did he take an active role in that?
He totally had trust in me and he knew before of the power of Qi and the power of Qigong. If I would give him a sort of an indication, can you do this or that, he would do it. But of course, his consciousness stage was limited because of the stroke. So he has an incredibly strong will. So I knew that. So if he, I just said to him, focus on the healing, focus on a completely healthy body. This was important so that both of us were aiming at the same direction and we weren't going in opposite directions because that can happen. And that's where even when you connect to the Qi field and inside you're thinking, yeah, it's not really going to work. You put blocks in your way. And so you want to try and keep that there's always a part of us that is, in many different traditions, they say that you're like a piece of gold. There's a part of you that's like a piece of gold. It can never get dirtied or sullied. And that's the part of us that we can work with. You know that there's always one part of you that connects purely, completely purely to the Qi field. And that's the one that, you try and get in touch with. Even if the person isn't working properly, you just say, come, think of yourself moving properly and speaking properly. It's, of course, very difficult.
Thank you for clarifying that. And I think many people in the Zhineng Qigong world know this part as the true self, probably, which you can connect with and which is not polluted by anything that happened in your life by environmental factors or experiences, right?
Exactly.
But please continue. You said that after 8 months, he got out of the rehabilitation. And then what happened next?
So then in Germany, they have a whole process in place where you get rehabilitated outside of the clinic. So you go to physiotherapy, logotherapy, and all these different therapies to keep you sort of active. And at this stage, most of the time, for most people, it's just to keep the person moving at a very low level. And most of the time, the people are not participating in it with an active wish to succeed in healing. They don't really know that's available. They just listen to what the doctor has said. And in this case, the doctors were saying, yeah, it's not really going to work out. But of course, I knew from my knowledge and experience that we've got Qigong on our side. And that made a huge difference. So I worked with his mindset, taught him how to work with everything. And over the years, so it's been now probably 1.5 years that he's been out of the clinic, he can sync his blood pressure 30 points by himself, just by using his mind and qi. The cardiologist was very impressed by that. All the doctors that work with him had said within 6 months of him exiting the clinic, all the arteries in his brain were healed and functioning normally. All the blood was flowing well. All the nerves were getting nourished. He also had kidney damage through the stroke. So his kidneys were only functioning 40% after the stroke. And through different things and Qigong, he also started Qigong as well. His kidneys are now functioning at 62%, and we're aiming at more. He has movement of his foot, and his lifting of his foot is occurring. And a few weeks ago, the physiotherapist, was able to remove all the spasticity on the right side of his body. And she said, Meghna, that's not medically possible because our model is, as soon as the brain cells get damaged through the bleeding, that is the cause of the spasticity of the muscles. Meaning, you see people with their arms frozen and so on. It's because one muscle is sort of over-triggering, and you cannot get the other muscle to compensate because the nerve signal doesn't stop to one part of the body. So it just stays in one direction. Both sides of the muscle don't work. And she said, it's not medically possible because those brain cells have been damaged, and that is the cause of the spasticity. And I said, no, don't worry. We're doing Qigong here. So she is very interested in learning about this now because she does research with doctors as well on these themes. So it's very nice in the medical field. We have met a few very interested and open doctors and therapists who are really willing to work with this. So that's been very pleasant for me to see. And also a few that have not been open for this type of thing, who are very happy with their framework of reference and don't want to go out of their framework of reference. And that's okay. You just move to a doctor that is more open for it and supports you. And even those people find it very difficult to think outside of their frame of reference, but they try not to get in your way.
Now, I have to ask that question because I know that your friend in this case is a doctor by profession himself. So obviously, he also has been trained and kind of indoctrinated with a certain view of the world. And how difficult was it for him to leave that aside? Or, because you spoke about the consciousness being broken into 1,000 pieces. Did that maybe even help because he didn't really have much left to hold on to there, and he could basically start with building up a new frame of reference, with your support. I'm just making it up here, so you have to correct me. I'm just trying to imagine what might have happened, but maybe we can explore this a little bit, because the mindset will in any case be of highest importance if we want to achieve healing in such serious cases, right?
Absolutely. I mean, first of all, I know what it's like to be ill. I was ill very long in my life. So I know in this phase, you feel very unstable where you are. You don't find a place of stability very often. So all of a sudden, to introduce something new, he saw what I was doing myself and on myself before he had a stroke. So he already knew that there were many contradictions to his school medicine, the way of thinking, his reference frameworks. And he also was very open to many different traditions and cultures. He doesn't want to go into them, but he knows that there are things outside of his frame of reference. So at least he can think like that. When we change frames of reference, it is sometimes very destabilizing. All of a sudden, everything is seen through a different frame of reference. So we don't recognize all the landmarks that we recognized before. So you have to have, in a way, a big part, trust sort of factor comes in. Faith factor. You can use these words, but it's also not that. It's rather, interviews like this or knowledge like this that show that there is a path. It's just invisible. It's not visible to the five senses. And that's how the medical world functions at the moment. Anything that we can measure is what we take as real. But in Qigong and other sort of traditional sciences, we work also with the other senses. And we start feeling sort of, the Red Indians would say, the path of gold dust. You're walking on a path of gold dust. And that's what happens when you start working with Qi. You know it's there, but it's not something that you can see with the five senses or measure. Sometimes just through, for example, La Qi, you feel the force between your hands. Or you feel it moving through your meridians and so on. But it's not. There are, of course, scientists who have measured that and everything like this now, but that's a different thing. The mindset for changing the frameworks, for him, it's very difficult, I have to say. And we are coming across a few blocks now with this mindset. And of course, you just have to go through these blockages step by step, and be kind to yourself, not judging yourself. Frameworks of reference are very helpful, and they can also be not so helpful. And when we learn to gain a flexibility between moving through frameworks, that's where true health lies. They say being able to hold two frameworks of reference simultaneously is a sign of intelligence, but it's something that we have to train, I find. And I found things like the work of Idris Shah might be useful for your viewers here. I found that very helpful. He's a Sufi master who wrote stories. And I found them incredibly helpful for breaking up frames of references. They are small stories that you can meditate upon, or because of the clash of ideas in the story, which is based on symmetries, different symmetries, you start automatically challenging your frame of reference, or not. Sometimes you hold on more strongly if it's a strong frame of reference.
My name is Torsten Lüdecke, and I have news for you. You can now access our podcasts in a very different way. If you would like to go back to any of the episodes and you just remember a certain topic or you have a certain question, please use our new bot and ask that question. Not only will you get an answer based on all the episodes we have produced before, you will also be able to directly access the very episode at exactly the point your topic and your question was mentioned. Please use this bot and make sure you don't miss out on this wonderful new feature of our podcast. We will put a link to that Sufi master in the show notes. So for anyone who would like to explore more, that you've got the name correctly. So just for the audience to know that. Meghna, you mentioned a detail here that I think can be of interest to many of our listeners. And that was about the blood pressure. You said that your friend is capable of lowering his blood pressure by 30 points within a very short time frame. So now this is obviously a skill that, if you have that, can be very useful. So could you explore a little bit more about what he's doing there exactly?
Okay, so high blood pressure is different for each person. So it's not something that I would say is it's dependent on the person who has blood pressure. And I'm not a medical practitioner of any, form. But I did show him how his qi flows, how it moves. And he is able now to see when his blood pressure is very high. He'll then measure it with a meter. And then automatically, the first thing he does, this might be helpful for some people, but it's not, again, there's a caveat here. It's not a one-size-fits-all solution for anyone, because each person has completely different qi flows in their body, right? But the main thing is, if blood pressure is going up, you want to bring it down. You want to bring the factor that is creating that down. And the first thing we do is focus on his feet. Yeah, so he focuses on his feet. And then he just starts regulating his breath. And with his mind, where the mind goes, qi flows. Yeah, the feet are just sort of a focus point for holding on to the movement. So, and that helps him then adjust his breath, because in yoga, for example, they have a triangle, which is to do with the mind, emotions, the body, and the breath. Those three things are continuously interacting with one another. And if you can regulate the right things in the right time, you can adjust it. But of course, this was training. I did it first on him. He could see that it could happen. Then he said, "Oh no, you're the only one who can do it." I said, "No, everybody can do it." Yeah, it's just you learn how to do it. You learn having faith in yourself, and then you can do it. Yeah. But like I say, I don't want to say that this is a one-size-fits-all.
Thank you for clarifying that. And I totally agree. And I think it's good that sometimes we just bring that into the podcast, because every person is different, although some of the fundamental laws stay the same for all of us. But when it comes to techniques, it might well be that depending on who you are or what your background is, some techniques work better than others. But I still think that what you described, it's a very simple exercise, and I don't think there can be much harm trying that if you are affected by high blood pressure, because at the end of the day, this is your body, and your body brings up the blood pressure, so it can also take it down. And if you find a way to support that, then that can only be useful. So, but I don't want to linger on that point. I just wanted to, bring it up because it is interesting for many listeners. But I want to go back to the overall theme, because your friend is not the only person you've worked with when it comes to either stroke or similar cases. Maybe you would like to explore a little more there. Maybe you've got another example, or maybe you've got other learnings that you would like to share with our audience here.
Sure. I have had recently someone from Turkey, and I want to share it for one reason. He is a young man, and his fiance found me online, and they said, "Do you think you can help us learn how to do this? Do you think we can?" The doctors wanted to remove his eye, because there was a growth in his eyeball. And so I said, I'm not going to treat you for that, but let's see how we can get the qi moving in your body. And so the first thing I taught him was how to collect qi, la qi. Simple, nobody can get that wrong, connect with the 8 verses and so on and so on. And this was interesting. So I took it a bit further. I found blockages in his field because he was having MRIs for the eye. And this radiation, I do another therapy from Egypt. It's called biogeometry. It's really helpful for electromagnetic radiation problems and flower essences as well. And I could sense the radiation in his field, and I removed that, of course, because that blocked his qi movement, and got the qi circulating and everything like this. And then all of a sudden, I could see that he wasn't a happy fellow, not just because of his diagnosis. I realized that he was, his partner also said that he gets angry very quickly. So he was holding a lot of anger in his heart and his liver. So the eye was also connected to his liver, this form, the doctors were saying. And so I told him to start doing forgiveness exercises. And this was really powerful. So he started forgiving everybody that he thought had wronged him. And then he also started asking people to, you don't always know who you've hurt or wronged in their system, in their framework system. You really don't know. And so I told him, also ask for forgiveness from everybody. People you know that you've wronged, people that you don't know that you've wronged. And the next session that we had, his energy had completely changed. Completely changed. It was so much lighter, so much brighter. Qi was flowing so well. And that was a huge part of his whole learning as well, to let go of all of that in the past. That was one thing that I would like to share. Of course, we carried on with the sessions and the cysts started reducing in size. And so he's carrying on with the Qigong. And he's doing a lot of Qigong every day for himself to gather energy to flow through, and he's reaching really high levels. And his partner is also doing it, and now they've brought their mother in doing it, and so now they might increase the number of people there in the small village who are doing it, which is really nice. So they set up a small Qigong group. Other people that I'm working with, also to do with just improving Qi movements. I have people who have arthritis of the spine. And again, someone who had been to me recommended me to her. She's in America. She had arthritis of the spine. It was so painful. She was going to get steroid injections in the spine. And I ask about people's lifestyles. This is very important. How they work, especially with the spine. The spine shows you really how you center yourself and how you move through this world. And for example, you can have a very flexible spine, but it's not a strong spine. And then you might have problems in your lower spine, for example. Yeah, because there's too much movement. Because you're too flexible, and the bottom is the anchor point. Yeah. But in this case, it was, she always put other people first, and she wasn't centering herself all the time. And so she was getting this arthritis of the spine. I just taught her crane's neck exercise, but with the caveat, because I can see the qi, taught her the tempo of how to move the qi through her spine. And through this, after one session, she went back to her doctor, and he said, I don't think you're going to need the spinal injections anymore. And she said, yeah, I don't have the pain anymore. It was just that the qi wasn't moving through the spine. And so that, it came up as arthritic spine. Now she also had IBS of the stomach, of the whole intestinal system. That's disappeared. She had anxiety. That's also disappeared just because Qi started moving.
Right.
Yeah.
Right.
And she does La Qi as well, and the 8 verses. So very simple work tools.
And I think this is a particularly interesting example here, because the diseases you describe, the automatic reaction as a medical or just as an ordinary person would be something completely different. So if you talk about arthritis, first thing is nutrition that I would think about. I would say, okay, well, this woman has to change what she eats. Or when you talk about anxiety, you think about, well, maybe she should talk to a psychotherapist. But none of this is actually the real cause. Yes, you can work with these things and they might better the symptoms, and they're all useful, so don't get me wrong. Yeah. But the real cause is something else. It's that the Qi isn't flowing freely. And obviously the Qi is the life force energy. So if that is blocked in any way, then there is an issue, then there is a problem. And so I don't know what the causes of the Qi blockages was for this woman, but I would like to come back to the case that you discussed before, because that was obviously linked to unresolved emotions. And that reminds me of the amazing work that the Master Chen is doing. I'm not sure how familiar you are with his work, but it's the psychology of inner perception, where he basically talks about these issues and how these unresolved emotions are causing all these issues. And in particular, when it comes from the heart, and forgiveness obviously is very deeply rooted in the heart. So I think this all comes together very, very nicely. So I'm very grateful for you sharing all this.
Yeah, Master Zhen is a fantastic teacher for anyone who's not done anything with him. It's fantastic courses.
Now, if you would like to, if there's any message that you have for the audience here, summarizing the insights that you had in the last years of your practice. I know I should have asked you that before so that you can prepare, right? But if anything comes up where you feel like, okay, here's something I would love to get the community knowing, what would that be?
Ooh, that's a loaded question, isn't it? Qi exists. I think the deeper I go into this field, the more amazed I am by it. It's not that this sort of idea, I'm always doubting. I'm someone who doubts and at the same time believes in it because of my experience of it. And so, for example, just recently, I mentioned to you, I did Bigu, the fasting, where you just nourish yourself with Qi. I'd done it before, with water, and I did 20 days without food, just nourishing myself with Qi. It's not for anyone at home. It requires special training, so please don't try this, yeah? And then the last 4 days, I've been doing it without food, without water. And that's really where you start seeing, first without food, you start realizing, what am I being nourished by? And now this time, without food, without water, really, it started a real questioning in me. How is this universe structured? What is it that we're not understanding with our worldviews at the moment? And I would really sort of say the biggest thing I've taken away from all of this is, yeah, the 5 senses work, but they're not everything. There's a huge amount of the world that we still haven't discovered. And I really would encourage people to be curious about it, especially Qigong. If you're doing your exercises, try and see, where is the Qi moving? Which center am I working with? Is it Jing Qi or Shen that I'm working with? Don't be afraid to put these questions in the Qi field. You will get answers. How can I, or when you communicate with the Qi field, how can I deepen my practice? How can I change my posture so that more Qi flows through my body? Do I need to adjust my hips? Do I need to, most of the time it's a joint adjustment that has to occur, or a mindset adjustment, or a breath adjustment. I have to say, it's an extreme form of mindfulness that we need to cultivate and become aware of. And I would say that is for me so exciting, so interesting. You know, I'm not interested in a Gucci bag or a Chanel this or that. Doesn't do it for me. Qi, how it moves through the body, how it moves through the whole field, how it connects with someone else, how the field is set up. That is interesting for me. And I think if you cultivate an openness to, like in the 8 verses, to become so open that the Qi field can show itself to you through your version of it, I think that's the greatest benefit. If everybody connects so that it shows you, because each one of us has, our connection, and each one of us has something amazing to share about the Qi field. And I think that is if everybody aims for that, it'll be amazing, because we'll find out so much.
And I think that was a wonderful closing words, Meghna. I don't know where you got that from out of the Qi field, probably just channeled it into yourself. And then you spoke these words, and talking about contributing to the Qi field. You've been a great contribution today. Thank you for sharing all your experiences with us and with the audience here. And of course, we will have your contact details in the show notes. So if anybody feels like they want to get in touch with you, you're a fantastic therapist and have a broad skill set, not just Hunyuan Qi therapy, although I know you base a lot of your work on it, but you've got other natural health and well-being methods as well. So depending on who that person is and what the case is, you have a broad spectrum of tools that you work with. And thank you for being such a contribution to us here, to your patients, and and all together. Thank you very much, Meghna.
Take care. Bye.
We trust you enjoyed this conversation, and we invite you to subscribe to our podcast so we can stay in touch and notify you of future episodes. We will end today's episode with the 8 verses meditation performed by Zhineng Qigong teacher Katrin Hendricks. Enjoy. To get your free ebook on the 8 verses meditation, please check the show notes below.